My experience with sleep apnea went untreated for decades, and it manifested itself in various things, really odd things if you would put them all together. So for years I had, I was prescribed medication for acid reflux. I had, a skin cream for rosacea, a scalp treatment for my seborrheic dermatitis. So I had all these various ailments treated, and one year my primary care doctor said to me, maybe you have sleep apnea, because I went in and was complaining about being incredibly fatigued, and there were no discussions about all of these other symptoms. And I would say to him, sure, I'm super tired, I'm very depressed, and he even talked about putting me on medication for depression. And I said, I'm not going on medication for depression. I'm depressed because I'm exhausted and my feet hurt and my back hurts. And the exhaustion aspect of it led him to recommend that perhaps I had sleep apnea. And so, of course, I went for the sleep study and was then diagnosed with sleep apnea. Being diagnosed with sleep apnea, none of the issues of foot pain or rosacea or things like that were discussed. So I can't really say that my successful treatment of sleep apnea was directly correlated to all of those things. But I suffered from all of those things for decades, and now no longer do. Now that I have a successful course of treatment for my sleep apnea, so I'd have to say that I've had great success using the appliance. I do get fantastic sleep, and my overall clarity is improved. I'm no longer exhausted all the time. I'm not depressed all the time. So I'd have to say that the appliance has been a great benefit to me, really. So I'm 45 years old now, and I do often wish that I had come across some kind of treatment or understood what was going on, my late teens and early 20s even. So I do wish that I had discovered this treatment, or if this treatment had been available, years ago. First I started on a CPAP, which actually relieved my symptoms, but I found that I couldn't tolerate that because the CPAP irritated my sinuses to the extent that I actually couldn't breathe at night. So I did try a few different oral appliances, because the issue I have is sleep hypopnea, where my jaw, when I sleep at night, my jaw falls all the way to the back of my throat and restricts my breathing and prevents me from getting oxygen while I sleep. So I did try a few different oral appliances, and I was working with my dentist, and we tried a few different things. And she actually met David Rosen at a seminar and recommended him to me a few years ago. So when I came here, I was still suffering from the sleep apnea symptoms, and working with David, I got into a good appliance a few years ago, and I use it on a regular basis. And all of those symptoms that I once had are now no longer, which is a great benefit to me. So it's great to come in the office. The staff are fantastic, and they're super friendly and helpful. It's easy to schedule time here, and working with Dr. Rosen, he's very skilled in what he does. He's very professional, and you're guided to the correct appliance. He has several appliances that you can choose from, and so it's easy to determine what appliance would work best. So over the course of a few months working with Dr. Rosen, made very minor adjustments to the appliance to get my jaw alignment to the correct position, and as those months progressed, I could feel that my symptoms were subsiding, and ultimately I went back to my sleep doctor, had a sleep test, and my apnea symptoms had completely subsided with this appliance. If you ask me, I don't think I ever did snore, but if you ask my wife, she would say that she's also very grateful that I now have this appliance, because apparently she's getting a good night's sleep as well. And regarding snoring, the additional benefit is I'm no longer getting kicked or elbowed in my sleep from my wife, who obviously was very aggravated from a noisy husband. So that is a benefit to the peace and tranquility in the O'Brien household.